Hi, my name is Jaya. I am an ICU nurse and nursing educator. I have got over 25 years experience, 20 years of clinical experience with patients and 5 years in teaching. Most of my experience is from Kingdom of Saudi Arabia. Do you know the left lung is smaller than the right lung? Okay, we are going to see about the anatomical size differences between the two lungs and two bronchi in detail in today's video. Come, let's get started. The lungs are the primary organs of the respiratory system. We have two lungs, the right and left lung. Both are responsible for exchanging oxygen and carbon dioxide. The lungs are not equal in size. The left lung is slightly smaller than the right lung. The right lung has three lobes, upper, middle and lower lobe, whereas the left lung has only two lobes, upper and lower lobe. It has no middle lobe. Why left lung is smaller than right lung? The left lung is smaller because two-thirds of the heart is located on the left side. So the left lung is smaller because of the space occupied by the heart. The approximate weight of the left lung is 650 gram and right lung is 700 gram. So the right lung is bigger than left. The heart is slightly tilted towards the left side. The left lung has a notch that accommodates the apex of the heart. The concave cavity is called the cardiac notch. This cardiac notch allows the heart to fit snugly within the thoracic cavity. It gives space for the heart. So the left lung is smaller, narrower and longer than right lung due to the space occupied by the heart. Whereas the right lung is bigger than left lung, but at the same time it's wider and shorter. Why the right lung is shorter and wider than left lung? It is because of the position of the liver underneath it, as you see in the picture. Liver is located in the right upper quadrant of the abdomen below the diaphragm. The diaphragm is located below the lungs. So let us concise the differences between the right and left lungs. The right lung, it is large and heavier. Left lung smaller and lighter due to the space occupied by the heart. Right lung has three lobes, upper, middle and lower. The left lung has two lobes, upper and lower lobes. Right lung is shorter and wider than left lung. Left lung is longer and narrower than right lung. Right lung does not have cardiac notch. Left lung has cardiac notch and a concave cavity where heart lies. Right lung provides space for the liver and left lung provides space for the heart. These are the main differences between the right and left lung. Now let's see the size difference between the two bronchi. The trachea divides into the right and left primary bronchi. The right bronchus carries air to the right lung and the left bronchus carries air to the left lung. The right main bronchus is wider, shorter and more vertical than left bronchus, whereas the left bronchus is narrower, longer and more horizontal than right bronchus. The carina is located at the bottom of the trachea at the point where it bifurcates into the right and left bronchi. When a critically ill patient is intubated, ideally the endotracheal tube should be placed within the trachea just above the carina where the trachea bifurcates into right and left bronchi. Since the right bronchus is wider, shorter and more vertical, the ETT tube, the endotracheal tube, accidentally goes to the right bronchi very easily. As a result, what happens? Only the right lung is ventilated. The left lung will not receive any tidal volume, FiO2 or PEEP. PEEP means positive end expiratory pressure. So the left lung will get collapsed. Why we should have the knowledge about the anatomy of respiratory system? Accidental right endobronchial intubation is more common in critically ill patients. It is mainly due to the anatomical reasons. Left endotracheal intubation is very rare. For example, if there is diminished breath sounds on left side of the lung, and asymmetric chest wall movement, you can suspect that a right mainstem bronchus intubation has occurred. If the assessment findings reveal that the tube is not correctly positioned, and if you suspect the right mainstem bronchus is intubated, you can deflate the cuff and withdraw the tube 1 to 2 centimeter and fix the tube firmly. Then re-evaluate the patient for correct tube placement. If such complication occurs and if left uncorrected, it can result in overinflation of the intubated lung and atelectasis of the other lung, followed by secondary complications can also result in hypoxemia, respiratory acidosis, barotrauma, cardiac arrhythmias, hypotension or tension pneumothorax. Also, right lung is more susceptible for aspiration due to the anatomical reasons. So, if we have good clinical and theoretical knowledge about the respiratory system, we can do the correct intervention immediately without any time delay. We can save the life of the patients without any residual defects. Hope you are now clear with the size differences between right and left lung, also the right and left bronchi. That's all for today. If you haven't subscribed to my channel yet, please subscribe, like and share so that you will not miss any informative videos. See you with an